Okay, Bismillahirrahmanirrahim. Assalamualaikum and a very good morning to everybody. Yang berbahagia Tan Sri, Datuk-Datuk, Tuan-Tuan dan Puan-Puan, and members from our British Graduate Association Malaysia, USAM, and other alumni from British and non-British universities, and my dear friends. Welcome to our fourth series of British Graduate Association Malaysia Live to Inspire Talk. Actually, this program, we have it since August last year. It was launched by our Tun Hanif Umar. He was our also our former president of British Graduate Association Malaysia. Today, our guest of honor for today's talk is Dr. John Chan, a heart specialist. I'm sorry, when I heard our guest is a heart specialist with today's background of COVID-19, I would like to ask him, actually, this is a burning question. Why? A number of deaths due to heart attacks being connected with the this biotech mRNA-based vaccines. Sorry, Doc, for not being patient enough in asking this burning question from me. Anyway, Dr. John Chan Kok Meng is a very distinguished heart surgeon, and currently he's a consultant cardiothoracic surgeon at Cardiovascular Central KL Hospital. He was a recipient of British High Commissioner's Award scholarships to study medicine at Nottingham University, UK. He received his PhD in cardiac surgery at the Imperial College and his MSc in clinical trials from London School of Hygiene and Tropical Medicine. Dr. John Chan returned to Malaysia in 2012 at the invitation of Ministry of Health to strengthen the newly opened heart center in Kuching. In 2016, he returned to KL and involved in the setting up a structural training pathway for Malaysian cardiothoracic surgeons in collaboration with Royal College of Surgeons, Edinburgh. Dr. John Chan has presented extensive lectures and presentations internationally at major conferences, published numerous scientific papers, and also the author of textbook Functional Mitral and Tricuspid Regurgitation. He is a fellow of the Royal College of Surgeons, England, and fellow of the Royal College of Surgeons, Edinburgh. Recently, he was awarded a Hunterian professorship from the Royal College of Surgeons, England. Yes, our today moderator is Dolly, BGAM ESCO member and the chairman of Networking and Social Committee. Once a professional in property developer, now spend most of the time with family and other social works. Let me hand over to Dolly. Thank you very much. Dolly.
Thank you, Dato'. Yang berbahagia Datuk-Datuk, Tan Sri, Datuk-Datuk, ladies and gentlemen. My name is Dolly Chor, and I'm the moderator for today's talk entitled Evolution of Heart Disease Treatment in the 21st Century. This will be presented by Dr. John Chan Kok Meng. This is BGAM's fourth series of Live to Inspire talk initiated by our chairman, Datuk Kamaruddin Ali. Today, we are proud for having over 500 people who have registered for this talk, though maybe today we have 316 participants who have logged in to our Zoom system. Our talk is about heart disease, and Dr. Chan will give us a deeper insight and help us understand about treatment and how to go forward if you have some trouble. We have today a broad spectrum of people coming from different backgrounds, ranging from medical students to medical doctors, professional men, businessmen, and political men, if there are any. And the intention of today's talk is not meant to be a medical lecture as what Dr. John Chan often does, but to bring medicine for the understanding of the masses. Without much ado, let us welcome Professor John Chan to our limelight today.
Yeah.
Can we have him on screen?
Hi, Dolly. Thank you.
Hi.
Thank you very much, Dr. Kamaruddin, for that very kind introduction, and thank you, Dolly, and thank
My
you,
pleasure.
thank you so much to the British Graduates Association of Malaysia for the invitation. It's really a great pleasure to come and speak this morning, and thank you everyone also for coming this morning on a Sunday morning to this session. We hope it will be very interesting and helpful to everyone.
Yeah, okay. Mr. John Chan, Dr. John Chan, Dr. Kamaruddin has given quite a lengthy talk about you. So I will not go into such depth, but I just would like to say that Dr. John Chan is a true blue British graduate. And for this reason, we have chosen him to speak on our platform. He has a bachelor's degree, the first class honors, his master's degree, and his PhD. All are from British universities. On top of that, he was awarded the British High Commissioner's Award Scholarship for his undergraduate studies. And upon his completion, he was awarded Hunterian Award. Dr. John Chan, can you please give us an insight on your academic and professional qualifications and achievements in the medical fraternity while you were in Britain?
Oh, thank you, Dolly. Yeah, it was some time ago. Yeah, it started with the British High Commissioner's Award. I don't know if there are any other recipients here of the British High Commissioner's Award. This was a scholarship which was awarded in the 1990s. They've stopped giving this scholarship now, and
they call it chevening.
Yeah, they replaced it with the chevening. But it's a shortened version because the chevening award is now just a one-year award, and so it actually sponsors postgraduate studies, master's degree,
Right.
which are one year duration. But in the 1990s, they were a bit more generous, and the British High Commissioner's Award would sponsor your studies in the UK for 3 years, so up to degree level. So I was fortunate to receive that, and I remember at that time I was, of course, very young at that time, and we were interviewed by various people from the High Commission and from the Ministry of Health as well, of Ministry of Education actually of Malaysia, and towards the end of the interview, they asked if there were any questions. So I said, yes, I have, because I was very young at the time. I asked them, are there any conditions for this scholarship? And the High Commissioner said, no, there are no conditions. So I then asked him, why do you award this scholarship then? And he said, oh, well, we hope that when you qualify, you will become very good in your field. And then you will come back to Malaysia and contribute. And then build good relations between the two countries. But I stayed on in the UK for many more years before actually coming back. So I went to Nottingham. Maybe I can share some pictures here. I put together some just to make it more interesting. Hang on. I don't know if there are any Nottingham graduates here. So I was there in 1990. I'm sure there must be. I was there from 1990 to 1995. Can you see the picture? It's a Nottingham University. It's a beautiful place, a nice campus, and actually they have a campus in Malaysia now, and they built
Yes.
similar. This is the Trend building, so I think they have a similar design of this building in the Malaysian campus.
Okay.
So I studied medicine there, qualified 1995, and then in medical training, after you qualify, you work. But as you work, you're trained in the specialty you want to be in. So I undertook basic surgical training first, and then went into cardiothoracic. Cardiothoracic is surgery of the heart, lung, and chest. So anything in the thorax, essentially, in London. And most of my training was done at the various hospitals in London, but perhaps this one, the Royal Brompton, was where I undertook a lot of the training in heart, lung, and chest surgery, and acquired the skills there. And along the way, I was also interested in a lot of research because, and I'll cover a bit of this in the presentation. The reason why medicine is advancing so constantly is because research is being done. New discoveries are being made, and then methods have to be there to evaluate these new treatments. So I did quite a bit of this when I was in the UK. It was quite nice because the infrastructure was there, and of course you're working with the top experts in the field, and with that there's a lot of potential to progress in what you're doing. So this is Imperial College, and a lot of the research was done there because they have the expertise there. And yeah, I got a PhD there much later in 2011, and that has helped me in my practice even today. So I don't know if I've answered your question, Dolly. Is that
Oh yes, and you've shown even some nice pictures. But I just would like to let you know that there's got a guy by the name of RD. He graduated in 1999 from Nottingham as well.
We just miss each other. I left in 95. But 99, I was working at the Nottingham City Hospital in Cardiothoracic surgery. Yeah, so yes. So
I don't know what RD is, but I saw there's just his name appearing as RD.
Okay.
Okay, then. I'm very intrigued by the word Hunterian Award. As Malaysians, most of us have not heard, aware, nor understand what Hunterian Awards are all about. Can you please help us explain what these awards mean?
Hunterian.
Which organization confers this award, and how many awards have been given out in a year? What are the conditions that merit you to get this Hunterian Award? How many Malaysians have been awarded? And do you look at it like a class above?
Oh, okay. Let me share this screen again. Yeah, the Hunterian professorship. I was awarded this in awarded in 2014, but I only formally accepted the award in 2015 because you have to go to the UK and deliver the Hunterian lecture and then get the award. So at that time I was already back in Malaysia. I was working in the Sarawak Heart Center in Kuching, and the award is given by the Royal College of Surgeons of England, and you are nominated by the professors or the doctors we've worked with, and it's based on research done and the contribution of this research, the impact of this research on clinical practice. I'm not the first Malaysian to receive it. I'm the third Malaysian to have received it while working in Malaysia. The first two were actually pioneers in surgery about 20 years ago. The first two were awarded about 20 years ago to Malaysians. I think they may still be around. They're very senior surgeons who have now retired, but I think they're still around. So yeah, it is quite and Dr. Tan Sri Noor Hisham. So yeah, this was something which I'm quite proud of. So this picture is me delivering the Hunterian lecture in Manchester. That's one of the council members of the Royal College of Surgeons of England who awarded me the former medal of the award.
Wow, so proud of you, Professor Dr. Chan. Anyway, you have gone through a very long journey in the UK to come to where you were. and you have achieved a string of British recognitions. What made you return to Malaysia? How long was this journey? Were you headhunted? And why did you hunt for your return?
Yeah, okay. So my plan was always to return back to Malaysia, because after all, that was the unofficial condition of this British High Commissioner's Award. There's nothing in writing, but that was the understanding that I would return to Malaysia. But if you're a busy doctor in the UK, the natural thing to do would be to just carry on where you're working. And that's actually what happened. And because I've not been back to Malaysia to work in a hospital, in a government hospital or private hospital, so I had no idea what the health service is like in Malaysia at that time. Of course, we had a lot of working at the Royal Brompton Hospital. We had a lot of Malaysian fellows coming for training, and these are fellows who are actually working in Malaysia already, and they come and spend about 1 or 2 years in London to acquire additional skills. And so there was a lot of interaction with them. I got to know them, and then some of these, when they came back to Malaysia, they then informed various people in the Ministry of Health about me, and so I soon started getting emails from the Ministry of Health. The person communicating with me didn't indicate to me who he was, but of course I knew he was someone from the Ministry of Health. Until one day, he said he was coming to London. He wanted to meet me. So I thought, okay. Then I started taking him a bit more seriously. And when he met me, he told me about this new heart center that opened in Sarawak, which I could share this screen as well. Yeah, so this is the Sarawak Heart Center in Kuching. So my communication with the Ministry of Health was in about 2011, and they opened this heart center. This building was built many years prior to that, and there was this plan to for the Mayo Clinic in the US to run this hospital, but the plan didn't materialize. So this nice big building was completed and it was equipped, but it was not functioning as a hospital. So the Ministry of Health then leased the building from the developer for a nominal sum of RM1 a year and started running it as a heart center. But they didn't have enough expertise to run it as a heart center. There was only one cardiothoracic surgeon in this center, but they had all the other specialists. There were about 8 cardiologists, there were 4 cardiac anesthetists, there were 2 operating theater teams. They just needed a cardiothoracic surgeon. So when I heard this from the current Director General of Health who met me in London, I thought, well, it's such a good opportunity to come back to Malaysia, particularly as that was always the plan to come back. And this was the Ministry of Health facilitating the move back to the country. So I readily agreed to come back back then. So that's how it happened.
Yeah, thank you very much, Dr. John. Well, your first attachment back in Malaysia was in Sarawak. What's your first outlook in Sarawak on the practice of medicine and drugs use and diagnostic equipment, clinical techniques, doctors and paramedics in Sarawak? Is it a far cry from London?
Yes and no. Obviously, there are differences in the health care system in the 2 countries. So, when I came back, I not only not been to Sarawak before, I had never been to Kuching or Sarawak. So that was my first time there. And I never worked in a government hospital in Malaysia. But actually the heart center in Sarawak, because it was set up as with the intention of getting the Mayo Clinic in, it was actually had a lot of input in its design. So as far as the setup was concerned, and it was run by some very established cardiologists who had qualified from Australia and also from the UK. So actually, I would say the treatments we were able to provide in Kuching is comparable to that in London in most areas. Of course, in London, they have an edge in some of the newer techniques which are not available in Kuching. But for the vast majority of the treatments available, it is first class. Plus the fact that the Ministry of Health ensured that any equipment which was needed would be made available, because there was no point in not opening a heart center and not have having all the expertise there, but not having the right equipment to provide the treatment. So I think that the Ministry of Health has a lot of resources, but they need to be advised by the doctors on how to invest or how to use the resources. So when you have a very critical area such as heart surgery, they will provide the resources to provide the treatment. But of course, the need for this treatment is immense in the public service, particularly in Sarawak. So the waiting list is very long. But when the treatment is provided, it is actually a first-class treatment to the public.
Thank you. Now that you're back in Malaysia, how have you integrated Malaysia with London, or how have you, what have you done for Malaysia to help us and our people progress further from there on?
Okay, yes. Maybe I'll share this screen again, because I think this just shows how nice the hang on, let me just try and share this. So this is Sarawak. I don't know. There might don't know if anyone living in Kuching here today. There might be, but it's a lovely, beautiful city. And let me see if I can advance. Okay, so this was in 2012 when I came back. You can see how much they were waiting for another heart surgeon in Kuching. That even made the headlines in the paper. So one of the things I did help when I came back, there were already efforts to start training for heart surgeons in the country. The reason we are so short of heart surgeons in Malaysia is because there hasn't been a structured training. Training was very ad hoc and apprentice-based, but there were efforts already to start a proper training program in the country. So when I came back, the fraternity straight away caught on, because I'm fresh back from the UK with, and they wanted to. They were trying to set up a training system similar to that in the UK. So I was quite pleased to have been able to progress that. And these are two batches of trainees. The trainees are on the right, who had just been appointed into the training program. And this training program started a few years after I came back in about 2015. And we now have 28 trainees. And they should complete their training. The first batch, the most senior batch of 4 trainees will complete this year, in July this year. So that's a very exciting time. And I'm quite pleased to say that from this year, there will be a consistent number of cardiothoracic surgeons qualifying. This training program is quality assured by the Royal College of Surgeons of Edinburgh. The training is provided locally, but we are provided the curriculum and ensure that they are trained to the right sort of standards, and is quality assured by the UK's Edinburgh College. And at the end of that, they take the examination of the Royal College of Surgeons of Edinburgh and get the qualification. And this is along with that, I also help organize the international exams So prior to this, our candidates had to go to the UK to take their exit examination. So when you train as a specialist in cardiothoracic surgery, you acquire all the skills. But at the end of the time of your training, you have to take an examination to ensure that you have acquired the correct knowledge and skills. And prior to this, our candidates had to travel to the UK to take the exams. But the Royal Colleges of the UK were actually trying to bring the exams to the other countries. So rather than candidates going all the way to the UK, they thought it's better to bring the examiners to Malaysia. So this is the first cardiothoracic exam which was held in Malaysia. This was a couple of years ago, and these are all the UK examiners. Of course, I know most of them already from my time in the UK, so it was quite nice to, and that's the reason they engaged me, because they already knew me and they had confidence that the exam can be organized successfully. So we have held 2 sittings of these exams, but unfortunately the COVID has sort of disrupted this exam. But we will have another exam in May this year for our qualifying candidates. And then along with that, I used to do research camps for the Ministry of Health. So we would go to various parts of the country to engage the doctors there to do some research. So all these doctors would have had their research ideas and what they want to study. And at these workshops, we would look at their proposals and improve on them to a quality, to a standard where they will actually get some meaningful results from their research. So we held, over the 4 years I was in the Ministry of Health, we probably held about 20 to 30 of these workshops throughout the country. And I would say that the research output from the Ministry of Health has increased a lot as a result of this research camps, we call it at that time. And along with research camps, so these are 2 research camps. I think this was in, not sure where this was in, and this is, I think, this is in Johor. This is held in JB, and this must have been held in, I think this must be in Negeri Sembilan. So we went to various parts of the country. One of the nice things of this research camps is it actually allowed me to travel across the whole country. So I went to parts of the country you would not normally go to, including some of the more remote areas and some of the smaller towns in Sabah, Sarawak, and also in Pahang. And another thing, of course, was the database. In the UK, we were very good at collecting data, and at that time, we were not collecting the data in the country. So one of the things we did was to set up a national database for all heart and lung surgery in the country. So all the centers are participating in this, contributing to the database. This is our Director General with the Ministry of Health, and this was our first national cardiothoracic registry and research meeting where we launched our national database. And today we have more than 5,000 operations already entered. So this is quite useful because we need to know the outcomes of the surgery we do, so that we can then target, you know, the right sort of treatments for the right patients. And this is our fraternity. There are not many cardiothoracic surgeons in the country. These are probably most of the practicing ones in both the Ministry of Health, the National Heart Institute, IJN, and also in private hospitals in the country. So yeah, so these are some of the work I've been doing, in addition to, of course, looking after patients and providing clinical care to patients. But I think it's important that clinicians don't just provide care for patients. Of course, that's the most important thing, but to progress the specialty, and particularly to provide the necessary numbers of specialists in the country, we do need to train. Because if everyone just operated and didn't train anyone else, then we wouldn't have enough specialists. And of course, it's important to pass on the skills so that the best physicians, the best cardiologists, the best surgeons, actually those who are able to pass on their skills to the next generation, so that the doctor should be getting better. So the younger doctor should be better than the older doctors, and that's how medicine will progress. And it's important that we share this knowledge, we share the skills, and that's what some of the things I've been trying to advocate in this country.
Yeah, Dr. John, you have done a selfless contribution to the country, to the people, and we are very proud of you. I think the British High Commissioner has not done wrong in selecting you for the scholarship to start with. Anyway, I think many people are impatiently waiting for your talk. I shall not take so much of your time. It's better we deliver the platform to you.